All right. So today we'll go over our introductions, let you know who's on the call from Berkeley, and then we'll also go over Berkeley Public Health's mission, vision, values. We'll talk about how the program is structured. So we'll talk about timeline. We'll go through a sample curriculum, and again, Sarah will be able to share more content specific to the public health nutrition concentration. So we'll get a good introduction into that specific concentration. We will go over some of the logistics like program fees. We'll talk about scholarships that we offer. And then we will highlight some of our student outcomes because our alum are doing a lot of incredible things out in the world right now. And then we'll have time for Q&A at the end. So do feel free to send questions into the chat as they come up. But we will probably save answering those questions till the end of the presentation and make sure we have some time to chat. All right, so just a brief introduction. My name is Elise Rudolph. I'm the Director of Online Admissions and Recruitment, specifically with UC Berkeley's online MPH program. And I'm joined by my incredible colleague, Stephanie Nguyen. Some of you may have already met with her or been in touch with her. She's our online education recruitment manager. So we are your admissions team. We are here to support you, answer your questions, and be a resource to you if you choose to apply or as you're exploring our program. And our guest of honor, we are so excited to be joined by Dr. Sarah Zuba, who is the public health nutrition faculty lead. Sarah's research interests include evaluation of interventions designed to improve micronutrient status in young children and women of reproductive age, improving biochemical methods and tools used for nutritional assessment of micronutrient status and mineral absorption. We're really excited to have her because not only is she the faculty lead, but she's also, teaches many of the classes in the program. So she teaches nutritional assessment, public health aspects of maternal and child nutrition, diet and disease, and then global nutrition. So Sarah, we're so delighted to have you on and to learn more about the public health nutrition concentration from you. All right, and with that, I actually want to hand things over and give you an opportunity, Sarah, to share a little bit more about yourself if you'd like, but then specifically about this concentration.
Thank you so much. That was such a great introduction. So my research is really focused on maternal and young child nutrition, and I focus more in resource restricted settings. So a lot of my work has been done in sub-Saharan Africa. And then I have some partnerships with groups here at UC Davis and at UC Berkeley. And just really quickly to note that several of the courses that I teach are part of our core public health nutrition concentration curriculum. And then the diet and disease course is a brand new course that we are just launching this semester for the first time. And we'll talk about how our semesters are structured to accommodate your schedules and your kind of the working professional schedule. But the class is just getting started in a couple of weeks, so I'm really excited about that. But let me tell you a little bit more about public health nutrition at UC Berkeley. So our online public health nutrition concentration is our newest concentration within our program. So we are entering. We'll be entering our third year this coming fall. So we are the youngest of the OOMPH, our online Masters in Public Health concentrations, but we have had a very long-standing public health nutrition concentration within the traditional residential program at UC Berkeley. And so through that, we do a lot of collaboration with the in-residence program. Some of the faculty that teach the courses in our online program are the same faculty that are teaching the in-residence program courses. And we get a lot of the same speakers come and talk at both in both courses. And we have access to the same strong partner organizations. So there's a number of organizations that are local in Berkeley or in the Bay Area that we have really strong collaborations with. So Elise and Stephanie will talk more about the practicum component, but oftentimes we'll partner with our students will partner with these organizations for their practicum. The OOMP program is one of the top ranking programs for online MPH programs. So that's really exciting to get to. We've really fine-tuned our curriculum within this program, I can say. We respond to students and like what their interests are, what are the professions that they're trying to get leaving this program, and so that we can really make sure that we're gearing our courses to that skill set. And then we also have a really enriching curriculum. All of our courses, if you can check and see like what are the learning objectives, what are the outcomes that I'm going to get from this course, and that's a very iterative process, making sure that we're keeping everything up to date and relevant as you are going to be working and using this material as you're also taking the courses. I think that's everything that I have to say here. Some of the research that is done through public health and nutrition at UC Berkeley is really focused on food systems research. So we have a number of faculty that are working in food systems, looking at the intersection of nutrition and agriculture and healthcare systems. We also have a couple faculty that are really interested in physical activity. So looking at how, physical activity programs in schools particularly. And another faculty that is like me, who is really focused in low resource settings, particularly in sub-Saharan Africa. So you'll get to tap into all of these different faculty members, even though you may not be physically here at UC Berkeley. We bring them in again for guest lectures, and their research really fills out some of the curriculum that we're teaching in our courses.
That was such an excellent introduction. So thank you so much, Sarah. And I'll just take things to kind of a broad level. I wanted to share with you all the mission and values of our online MPH program, which are really also the mission and values of our school, Berkeley Public Health. So our mission is healthy people locally and globally. We want to extend Berkeley's reach to improve population health, especially for the most vulnerable, and providing the tools to address the pressing public health challenges of our time through innovative and transformative online learning with a rigorous and interactive curriculum. Sarah will talk more in a moment about what that curriculum looks like, especially for our nutrition program. We also achieve this through a flexible education experience that aligns with the needs of working professionals. Something I like to share is Berkeley Public Health choosing to offer the online MPH is absolutely, something that was done specifically to help achieve the mission of healthy people locally and globally. We want to provide folks the opportunity to have an incredible UC Berkeley education in the communities they're already a part of, so that you can stay rooted in your jobs, in your communities, and create impact in real time while you're doing this program without having to uproot your life and relocate to the Bay Area or, spend time during the day on campus. So this is really, the online MPH is designed specifically to help achieve this mission. And then we also do this through empowering public health change makers to improve health where they live and in real time. So, we just touched on this, but, the online MPH is strategically designed to help create impact nationwide and worldwide through a UC Berkeley education. And then our values are service in community, showing up with authenticity, growth rooted in justice and equity, cultivating connection through learning, and centering wellness.
I'm going to move over to program design, and I'm really excited to talk about this because I think this is where our bread and butter is the modality that we offer our platform to students. So as Sarah mentioned, it's very collaborative, but we have our own system of ensuring that you can still get your MPH, but do it at a space that's convenient to you. So for us, our units are a minimum of 42 units to take in order to graduate. The time of completion is typically 27 months. It's a 7-semester program. The average units taken per semester are 6 units, so that's usually 2 classes. The format that we offer is 90% online and 10% in person, with 2 separate campus visits required during your summer terms. So we pretty much have an online component, and then you shift to in-person for just about a week long. As you can see on the bottom, that's just a sample of the estimated dates. We typically will provide these dates to you during your new student orientation, so you have plenty of time to plan ahead. And the course delivery is mostly asynchronous. So this means that you can work at the time of day that's most convenient to you, and you're not required to be online at a specific time. However, there are going to be occasions and opportunities for guest speakers to be present. And sometimes there might be a kickoff session where we would want to ensure that there's community building and engagement as you come into the program. So there's going to be opportunities such as that to stay connected. And then in addition to the course delivery, I would also say that there's real-time faculty advising hours and opportunities to connect, whether it be independent or group advising. It is a flexible curriculum, so the flexible course options are meant to be able for you to pair different focuses to meet your needs. You can take a look at our course catalog when this is sent out to you. But essentially, you're here to build and craft something that is going to meet your needs academically, professionally, personally, and we do our best to ensure that you can select your public health nutrition courses, but also expand on other areas that might be of interest through your electives. And then the weekly commitment is typically 15 to 17 hours per week. This is a consistent number that our students have surveyed and shared with us. And the type of degree that you would receive is a professional degree. So moving forward to the program timeline, as I mentioned, it's traditionally a 7-semester program, so it's meant to be completed in 27 months. And as you can see here, there's other options as well. So in the event that you may be interested in accelerating it, you could complete it as early as 6 semesters. And if you need to pace it, you can pace it for up to 5 years. So there is different options for you depending on where you're at. And just to give you a little sample of how this program works, typically in a traditional setting, you would take 2 classes together for a 15-week full-term period in your first incoming semester. You'd follow the same format, and then once you hit summer, this is when the courses are going to be consecutive. So instead of it being concurrent, this model here would be typically 6 to 8 weeks of instruction per class. And once you complete that, you move forward until graduation. And if you are in a space where maybe you wanted to accelerate your coursework to 9 units, that's the max that we can do, you would then take 3 classes a semester. So this can just give you a visual guideline of where you might see yourself, but most students in the program typically follow the traditional method. And we also have 2 intakes. So keep in mind that there is a fall intake and there's a spring intake. So you either can start in August or January. And then moving forward, I'm going to pass this along to Sarah to speak a little bit more about the sample curriculum and go from there.
Great, thank you so much. So some of our courses are required across all of the concentrations. That includes all 4 of the courses that you're taking your first year. So the fall year 1 and spring year 1. And also the first course of summer, the Introduction to Health Policy and Management. So all of those courses, all students are taking. So it's a really great opportunity for you to build connections and community within your entire cohort. And then after that is when students will start to be able to select which courses they want to take. So for our public health program, some of the required courses are that program planning, development, and evaluation course, the maternal and child nutrition course, the food and nutrition policy course, the nutrition assessment course, the evaluation of health and social programs course. And then we jump back into another program requirement with that, which is that interdisciplinary seminar. So again, that is a course that everybody will be taking. Your entire cohort will all take that course at the same time. And that one is also tied to the summer visit. So I wanted to add, I'm going to pause really quick because I wanted to add that those summer visits are some of our favorite times as like a staff and faculty, because it's really like the only opportunity we have to meet a lot of you in person, especially those of you who are coming from other parts of the US or out of the country. And they are intense academically. You know, you're doing a lot in a short amount of time, but also we have opportunities to do like faculty lunches. So we will have small groups come together and go out to lunch. And that's honestly one of my favorite parts of being faculty in OOMF is those like really special times to get to know all of you. Okay, so that happens that happens during those summer visits, which that interdisciplinary seminar is kind of part of the second year summer visit is part of that. And then that concludes all of the requirements for public health nutrition. So there are 5 courses that are required: the program planning, maternal and child health nutrition, food and nutrition policy, nutrition assessment, evaluation, and health programs. Health and social programs. And then you will have 3 elective courses. And so you can go through the course catalog, and it's somewhat restricted by, you know, what is the semester when the course is offered and what is the semester when you have this like space for your elective. So not all courses are offered every single semester, but you have a lot of flexibility in terms of which courses you want to take for your 3 electives. And as your faculty advisor, so if you come to our program and are in public health nutrition, I will be your faculty advisor. And this is something that we would work on together. So I sit down with you, we like have a whole conversation about, you know, what has your career been up to this point? What are your career goals? We talk about like what kind of skills you want to develop, and then we can figure out which elective courses are going to be the best fit for you. And so, yeah, and then that diet and disease course that I was talking about, that is going to eventually be a selective with the maternal and child health nutrition, because we found that some of our students are really working more in adult populations and in the chronic disease area. And so this maternal and child health nutrition course was not serving that group of students. And so moving forward, so by the time that you would be entering our program, you would be able to choose whether you want to take maternal and child health nutrition or the more adult focused diet and chronic disease course as your like human nutrition requirement for public health nutrition. But you can also take both, because like right now I have a bunch of students who are public health nutrition who are planning to take that diet and disease course as one of their electives. So you could always do that if you're interested in kind of having both perspectives. And I think that's all I have for the sample curriculum. I will say that a lot of our students, you know, we said that normative time is 27, wait, what is it? 27 months.
Yes, 20, yep,
Yeah.
27 months.
What is the time frame? That normative time is 27 months, but I have so many students who things come up in their life. They are, you know, having a child, they have like, they're up for a big promotion at work and they kind of have like crunch time. They have, you know, a medical thing that comes up. And they end up needing to take either part of a semester off or a whole semester off. And so, you know, there really is so much flexibility within this program in term, like if something comes up, we can just pause and you can come right back to it when you have more bandwidth and more space to be able to focus on your coursework. Okay, I'll hand it back over to you all.
Thank you. So in terms of the practicum, this is actually another big component of the program. We believe the training that you receive and are working towards, we don't want you to have to wait until you graduate to be able to apply it. So we built this through the practicum for you to do in real time as well. So the practicum is a structured pathway for students to obtain practical experience within the field of public health and the skills that if acquired throughout the program. And there's so many different avenues that you can take in a practicum. There's students that move into research. There's some students that are more applied. It's wherever you feel you're headed, right? That's your pathway. You can decide which area that you want to do. And what this does is it enhances students' professional and leadership development. It's a minimum of 130 hours to complete, and it's self-directed, and it does have some structured guidance within the operating model as well. So what this means is that you can be in charge of where you want to go. If you are thinking moving in a let's say applied space, as I mentioned, and want to focus on that, that's okay to do. You'll have support from the practicum team, better known as RISE. They specifically support students with their practicum, their career and leadership support as well. So a lot of professional growth in that aspect. But in addition to that, you have your faculty advisors. So for example, Sarah to also work in support with you, and a preceptor. So there's many people here to champion you in this process. And the nice thing about the practicum is it can start as early as your second semester, but you have a span of time where you would just have to complete it by your sixth semester. And keep in mind, the traditional format is 7 semesters. So it's a long gap for you to focus on this. One of the things that I like about a practicum is that it leaves you with the opportunity to also reflect on what you're doing and see how you can grow while working on the practicum. So for example, maybe you start off with a particular project, but you're gaining these skill sets and asking certain questions that can evolve into something bigger. We've seen students work on research projects with other peers in the online program, with other faculty, and gain some mentorship in that way and capacity. There's some students that create their own practicum, bring it to their practicum consultant, and design it in a way that, as long as it meets the CFA competencies, our program outcomes, we'll work with you to ensure that you're on the right track with that. Sarah, is there any other particular practicums that you've seen that have either stood out to you, or any ideas of what they could do for an example?
Yeah, so I'll say that our RISE office does a really great job networking with organizations in California and mostly, and then in the United States predominantly, to develop more structured practicums where you can apply to that practicum, and then it's kind of already set up for you. So there is that pathway that you can choose, and a lot of our students who are doing a career change may choose that because this, like the public health sphere is totally brand new to them. But we also have a number of students who maybe are already have connections with organizations in public health, or are already working in public health, and are doing this program to elevate their career. And so a lot of times they'll design their own practicum. So I can give you an example of one student who just was recently finishing hers. She's a practicing OBGYN. And so she worked on a project within her health I can't remember if it was her medical center to update their protocols for iron supplementation during pregnancy. And so that was her whole project, was kind of working on updating what their protocols are, and then doing information sharing to shared all of this updated information with the colleagues within the network. And so you really, there's so many opportunities to build your own practicum if that's something that you want to do, or you can kind of choose from a really long list of developed practicums that are offered through the RISE office. Yeah, and again, this is something that I can work with you on a bit. The RISE office is definitely the source for technical components of the practicum, like what are the deliverables, what's the timeline, how do I apply? But I can certainly support you in figuring out what kind of a project you want to work on, or helping make introductions to organizations that I have connections with, or, you know, helping you kind of do the networking component.
All right. So to talk about some of the nuts and bolts of the program, the fees and tuition for the program are obviously, I think, really top of mind for everyone. You want to understand how to pay for the program if you are interested in applying. So right now, the cost of our online MPH is $1,478 per enrolled unit. And again, it is a 42-unit program in total. There are some additional campus fees, and you may be wondering, you know, why is there a campus fee if this is an online program? So what we always share is that if you enroll in UC Berkeley's online MPH program, you are first and foremost a UC Berkeley student. So you do have access to many of the campus resources. Well, you have access to all of the campus resources, many of which are accessible remotely. So you have access to library resources, you know, the RISE team that Sarah was just talking about, who support you with practicum. You know, some of this, the campus fee goes to the support that they provide, things like that. And then, of course, if you are in the Greater Bay Area, you are also welcome to come use the campus as well. There is a student health insurance fee. However, you do have the opportunity to waive this fee if you have health insurance already through an employer or otherwise. There is a small document management fee and an instructional resilience and enhancement fee. So some of those things are like our incredible instructional designers who create the online modules, which make the online program really engaging. And that brings the total cost of the program to $67,789 if you opt out of that health insurance program. Right now, the big question, how do folks usually fund the program? So there's a number of different ways that our students opt to fund their degree. So one route is the self-funded route. So we do have students who choose to cover the cost of the program. And you'll see down below, there's a fee payment plan. So for some folks who are self-funded, they might opt to do the fee payment plan, which basically allows you to make monthly installments toward the tuition. So you don't have to pay that $67,000 in lump sum, of course. You only pay for the units that you're enrolled in that semester, and then you can break it into monthly installments as well if you choose. So that would be sort of a self-funded route. The other way that you might go about paying for the program is through federal student aid. I highly encourage you, even if you're not sure if you're going to use federal aid, I highly encourage everyone to complete their FAFSA. And that can at least tell you what you would be eligible for. Now, a big disclaimer, federal student aid or at the graduate level, it really is predominantly unsubsidized student loans. So that's just something to keep in mind. That's definitely a resource. It's a common route that folks take to pay for the program, but just, you know, keeping in mind that it will be loans and not scholarship funds. And then another route that we really encourage everyone to explore is employee sponsorship. So many employers might have tuition benefits that they offer, Or you might have an employer who maybe doesn't expressly have tuition benefits, but they might be willing to help or assist with paying for your graduate program, especially if you plan to stay with that company for some time. You know, this adding the MPH program would help make you more effective in your role or allow you to move up at that organization. You know, so we have some tips on our website in terms of how you can approach your employer about asking for tuition benefits or employee sponsorship. Definitely check those out. And again, it's always worth knocking on this door, even if you aren't sure that this is something your employer offers. And then lastly, we offer a few scholarships as well. So the program does offer some scholarship opportunities. We have the Dean's Health Equity and Leadership Award. We usually award around 3 folks this scholarship each term. It would cover a total, the cost equivalent to 7 units over the course of the program. And that is predominantly a needs-based award. The second is the Rural Health Innovation Program. The Rural Health Innovation Scholarship is only offered during our spring terms. So right now we're accepting applicants for fall of 24, but if you are looking at applying later on, we would be awarding the Rural Health Innovation Scholarship in the spring. And that's really for folks who are living in HRSA designated rural communities and working on rural health issues already. So that would be a fully funded scholarship, again, for folks who are living and working in rural communities. And then our last one is the Global Health Leadership Scholarship. We will be offering 1 fully funded scholarship to someone who is living and working in India this fall. All right. So I'll talk a little bit about the application process, and I'll sort of try to go quickly through the application checklist because I'd really like to hear, you know, from Sarah as someone who reviews and evaluates applications more about you know, what she thinks makes a quality or a strong application. But generally speaking, we have a few prerequisites. So we are looking to see that you have stats or college level math with a B+ or higher. We encourage folks to have some familiarity and aptitude in biological or social sciences. It doesn't mean you have to have majored in that in your undergrad, but you know, we do require that you have some exposure to biological or social sciences, and then a minimum of a 3.0 GPA. And so the way we look specifically at your GPA is we're going to look at what we call your advanced GPA. And your advanced GPA is really everything after your first 2 years of undergraduate. And the reason we do that is for most folks, when they start their undergraduate degrees, it's a transitional period. You're sort of learning how to study, learning how to, you know, balance school and whatever else might be going on in your life. So it tends to be a more favorable GPA when we look at everything after your first 2 years. So we do have a worksheet that's linked when we send out the slides on how to calculate your advanced GPA. Stephanie and I also did an info session last night on how to calculate that. So we can send you those resources if you need help figuring out how to calculate your advanced GPA. We also would like to see a statement of purpose and a personal history statement. We do require 3 letters of recommendation from academic or professional sources. I will also note here that for many of our applicants, you may have been out of school for a number of years and might not be in touch with old professors or feel that you have an academic source. So that's completely okay. All of your letters can be professional if that makes more sense for your life stage. We require all of your transcripts. They can be unofficial, but we do require all transcripts from all institutions that you attended. So if you attended community college, you know, while you were earning your bachelor's degree, definitely give us all those. If you transferred schools at any point, we would like to see all of those transcripts. If you did graduate school, definitely send us those as well. And if you are an international student, we do require translated copies of your transcripts as well. We ask for a resume or CV, and then there is an application fee, $135 for US and permanent residents and $155 for international applicants. If you are an international applicant, we would likely ask you for English proficiency as well. And then we do not require the GRE. So if you have taken the GRE, you are welcome to send us those scores, and the school code is listed, but we don't require it. So no need to go out and sit for it if you haven't already done so. And with that, Sarah, as someone who reviews applications, I'm curious what you feel makes a strong applicant, especially for public health nutrition.
Yeah, so for public health nutrition, our focus is mostly applied nutrition. So looking at nutrition programs, nutrition policies. We talk a bit about like the major nutritional challenges in the US, in specific subpopulations and globally, but we do not go into like the biochemistry of like how nutrients move through your body, how nutrients are absorbed. You'll kind of get touches of that as it is relevant to the material. So for my nutrition assessment course, of course, I'm talking a little bit about the biochemistry when we're talking about, biological markers, but it's very minimal. So I would say, that our program is very different than a nutrition science, like a master's in nutrition science. So with that said, it's not a requirement to have taken nutrition courses before, but if I see that, especially if there are other areas where maybe like you haven't taken as many stats classes, or you haven't taken, maybe your GPA is a little bit lower. If I see that nutrition curriculum in your background, then that is definitely something that stands out for me. Similarly, I would say that I definitely check the math that everyone, like that is definitely something that I am looking at. If you haven't taken a math class in a really long time, or you didn't really take you've never taken statistics previously, then that would be maybe something that I would suggest doing before you enter the program, is take like a basic statistics class, or even, you could do an online statistics course. It doesn't need to be like officially through a university. And then you could talk about that in your statement of purpose or your personal history statement. But, some sort of making sure that you are up to date on your stats, because that biostats class and the epi class are really, you're doing a lot of math in those courses. And so that is something that I always look at. In terms of previous public health experience, that is also not a hard and fast requirement for our program. I definitely take into consideration your lived experiences. So if you have you can talk about, how has public health kind of intersected with your path in life. And that those experiences are also very relevant to how you would be as a public health professional. So, I would say math is a key one. And I know that that's really intimidating to a lot of people because, if you haven't come from a math background, or, you haven't come from like a hard science background, that maybe you've never taken those courses, but that doesn't mean you can't do it. Like you definitely can do it. You just might need to take a class before you apply for the program, or be prepared to like really work hard in the biostats class. Similarly, our minimum GPA is 3.0, but if you have been working in a related field for a long time, and maybe your GPA is from 15, 20 years ago, and is not really reflective of who you are as a person now, reach out to us, because we can work with you on that, on a case-by-case basis. So I don't want that minimum GPA to be something that is really like the one thing that is standing in your way from getting your MPH. So you can talk with us about that on an individual basis. I think that's everything. I can answer more questions if you have specific questions when we get to the Q&A session, but I would say those are the things that I look at the most. And of course, the statement of purpose and the personal history statement really allow us to get to know who you are as a person, and why are you doing this program? How do you plan to use these your degree? Why, like having a strong why of like, what is this program going to do for you and your career? I think that that's something that I also really look for in the applicants. I don't, if it's like, oh, I had no idea what to do with my life, and so I thought I'll just go back to school. That doesn't stand out to me as much as like, this is why I'm doing this program. I want to, like, this is the path that I want to get on. Okay, I think that's it.
Yeah, that's great. Yeah, that's no, I think that's so helpful. And the only other thing I'll add, and Sarah really talked about this already, is that we do holistic review, and so there won't be one component that we're going to look at in a vacuum. We really do, as Sarah said, try to read your essays, get to know you, and look at you as a whole person. All right. So as we mentioned earlier, we are accepting fall 2024 applications. So this would be applications to begin the program in August of 2024. So that application is open right now, and we are accepting applications through March 3rd. So if you are considering applying, you definitely still have time. You have a few weeks, and Stephanie and I are more than happy to meet with you and work with you if you would like to get your application in by that deadline. And if you aren't feeling quite ready to start a program in August, we understand that. And we are also accepting applications for our spring 2025 cohort. That program would begin courses in January of 2025, and you have until August 8th to apply. All right, I'll pass things back over to Stephanie.
Thank you so much. And thank you for all these questions that are coming to me. I will definitely share them out, as I think they'll be relevant to other attendees here too. So for the salary and employment, this is just the average salary that we recently surveyed our students coming out of the program with an MPH. Here you can see some of the recent graduate titles as well. And this is just honestly scratching the surface, from senior financial analyst to community health program specialist. We have students and coming out to Gilead, UC Davis Health, Deloitte, and so forth. So there's one of the benefits to our program is our alumni. We have over what was it, Elise? Probably almost like 18,000 alumni as a school.
Yeah.
And that's all connected to you. And one of the fun facts that, some of you who may have connected with me know this already, but if not, many of our online students actually run the Public Health Alumni Association and are very involved with the program. So, I cannot stress enough how this program is built for flexibility. But the students that are in the program want to engage and want to be supportive and active, whether they're a student and when they move forward. So, when you think about terms of employment, we have a strong network, and it's not limited to what you see here. And I hope that, as you consider your MPH and thinking what that looks like for you, just know that within our program, we have a lot of students that are working together to be able to be in different spaces across the globe, which is so exciting to say. And as we get closer to the end of this, I also want to include our upcoming events in case you have started an application or planning to start one. Our next info session will be the epidemiology and biostatistics info session with Dr. Sandra McCoy. We also have a graduate writing workshop coming up pretty soon. And if you want to keep in touch with us, which we would love, to connect with you through our socials, you can find us through LinkedIn, Meta, Instagram, X, or Twitter. And just stay in touch with us. We are pretty active on there. And with that said, want to say thank you for making time to connect with us today and be present here. I hope that you found this valuable. I'd love to open this up for Q&A, so feel free to just drop your questions in. You can unmute yourself as well. Sarah's here to answer some questions, and as we are for the admissions team as well. Yeah. And I'm going to respond to a quick chat. Elise, do you want to take the
Oh, yes, I see we have a
Thank you.
hand raised. Please go ahead. You can feel free to take yourself off mute.
Thank you very much for the intro session. And I want to start by thanking also Stephanie for her amazing advice during the appointments. So if any of you guys have any questions later, feel free to just put a one-on-one appointment with her. I think it's like 30 minutes appointment. You have a little calendar, or you can pick the time. It's really clear and great. So highly recommend it. So I had a question about so the required courses related to the ones that are like shown on the website and the ones that we would be able to take. So I think many people have seen the student handbook for the in-person public health nutrition concentration. It's like very detailed and has like a few different choices for the public health nutrition requirements. And for example, for the human nutrition course requirements, there is the maternal and child nutrition course, but also the diet and chronic disease course. And it's so great that, Sarah, you mentioned that now diet and chronic disease course is going to be an option to take to satisfy this requirement. And so I was wondering if there is somewhere where there would be like a full list of like all the courses that will be available. And I think Sarah dropped a link with all the course catalog. And for the people who are watching this recording, can we find where can we find this list? And also, I will add as well. I know that there is also an option to take 2 additional courses from the public health department at UC Berkeley, either in person or online. Could you tell us a little bit about that as well?
I can take this question. So, okay, regarding the options for the in-residence program versus the online program. So it's funny that they already have my diet and disease course listed. I haven't looked at the student handbook. That's great that they are on top of that already. But yeah, so our public health, our online courses, there's more flexibility in terms of mixing and matching what you want to take, but we are limited to the courses that are offered online. And so as a public health nutrition student, if there is a specific class that you want to take that you want to sub for another like public health nutrition requirement, we can work on that together. That is possible within the context of you still meeting all of our CEF competencies. And the same rule applies for the in-residence program. So, there is some flexibility, like if there's a course that you really, really want to take and it's going to be super helpful for you, and there's another like a course requirement within our concentration that is maybe not going to be as useful to you in terms of what your career goals are, we can definitely work individually to come up with like a subs, if there's like a class that you want to sub, we can do that on an individual basis. Yes, you can take as an online MPH student, you are able to take I think is that correct, 2 courses in the in-residence program. So yeah, if you live locally and you have the flexibility in your schedule to take a regularized like Monday, Wednesday, Friday class, you definitely can do that. And so you can go on to the course catalog for the university and see if there's a course that you're interested in. I would say that the students that I have do that are typically taking a class that's outside of public health. So they are interested in like an environmental health course, or they're interested in a nutrition science course, or they're interested in like a business course, or, you know, there is some other course that is outside of public health. And those, you know, the courses that are outside of public health are not available online because, you know, our online MPH program is pretty unique within the university. I think there's a couple other online professional degree programs, but not many. And so you can do that. It just is about your schedule, and if you have the ability to, you know, the flexibility in your work schedule or your life schedule to be able to make those in-person required courses. I'm trying to think of were there any other components to your question? I know I've forgotten. Does that answer everything?
This is great. Yeah, that answers everything. And I
Yeah.
guess I understood as well that we would be able to work with you with our professional goals and skills and history to make the best path for us. That sounds great. And I did have a question about kind of the concentration that we're choosing. So like right now I'm all about nutrition, and I would really love to go into that. And I understand that on the second year we declare this concentration. And so my question would be, what if we were interested in getting some skills in epidemiology, for example? Are there any barriers or anything like that that would bar us from taking courses of the epidemiology concentration, for example?
Yeah, no, we have a lot of our students end up switching concentrations or, you know, dabbling in other areas. So that's the once they enter the program. So, you know, that is you can either do like if you're interested in epidemiology, you can take those epi courses as part of your electives. Because remember, you have the breadth courses that are required, you have your concentration specific courses that are required, and then you still have 3 additional elective courses. So a lot of our students will just, you know, if they're interested in epi, they'll take 3 epi courses. I will say the caveat is that some of those higher level epi courses are 4 units instead of 3 units. And so then they follow the traditional 15-week schedule instead of our condensed 8-week schedule, just because of how the units work out. But again, that's something that you and I can talk about, and we can figure out your schedule and, you know, like, you know, see how that could fit into your kind of your course mapping. So yeah, we definitely have people who take epi. We have students who are interested in the health policy management certificate. So sometimes students will do the public health nutrition concentration, and then they'll do that certificate program and have their additional classes there. Again, you know, our requirement to complete the program is 42 units, but, you know, you can also take extra courses. It's just a matter of, you know, your personal preference. So say that you've completed your 42 units, but there's like this one other class that you really want to take, you can do that. You can also do that after you've graduated. So once you have graduated from our program, you are welcome to take additional courses, you know, given that there's space available in the course. Yeah, but so like I have the census diet and chronic disease course is brand new. I have a student who graduated last fall, and he didn't want to like enroll an entire extra semester, but he really wanted to take this class. So he's taking just this class after graduation. So yeah, definitely you can take courses that are outside of public health nutrition. Sometimes even as the public health nutrition concentration faculty advisor, I will sometimes advise you to drop our concentration. Like if it's not serving your needs and it's not a good fit, then I have made that recommendation to students before. So, you know, you're not totally stuck in one concentration, especially if you're going from public health nutrition to interdisciplinary. It's a little bit harder to make the transition from one concentration to another concentration. You know, it can be done, but given, you know, how many of the requirements you have taken, how many units you have left, that gets a little bit more complicated. But, you know, certainly we have students moving around once they're in the program.
Super interesting. Thank you.
Liz, do you want to?
Yeah, thank you guys so much for having this webinar specific to the nutrition MPH. I have 2 questions. I'll ask the first question, and then I'll ask the second question after you've answered that. So I'm actually finishing my undergraduate degree in dietetics, and so I'll have to be doing a dietetic internship at some point. And I believe they're about 10 months. So I'm wondering how long can you take a break from the MPH program to do something like that? And if so, how long of a break do you guys allow?
Yes, you can take a break. I'll have to defer to Stephanie or Elise about the limitations of the break. But I will also tell you, I don't know if you know this, but UC Berkeley has just launched their a new public health dietetic internship. So I can share with you the link for that. Are you already aware of it? Now we have 2 dietetic internships through UC Berkeley. There's one that's through the nutrition department, and that's like more of the traditional dietetic internship that is coupled with like a DPD, like all other prerequisites to become a dietitian. And then our public health nutrition dietetic internship is kind of a standalone program. So you have to have so like you'll have to have already completed all of your prerequisites, and you're just doing the internship. And so that could be something that we can work with you. I mean, it's through a separate application process for that internship. But you should send, if you're interested in learning more about that, you can send me an email and I can connect you to the director of that program. Or you can Google, just make sure if you Google it that you're looking specifically at the public health dietetic internship and not the nutrition science one at UC Berkeley.
Okay. Yeah,
But yeah,
that's awesome.
you can definitely take a break to complete your internship. We also have some students, if they're doing like a distance DI program, they will do both simultaneously so that you can continue to do your MPH program and then you would do your DI program at the same time.
Okay.
Especially since our program is a part-time program for working professionals. We have some students that it's not, as long as they can take a step back from their regular working jobs, it's manageable to do both at the same time.
Okay. Yeah, I think the distance DI I was looking at has like a part-time or 4-day a week option as well, which would make it manageable. But just curious about that timeline. So thank you. And I'm really interested in learning about that public health internship. Dietetics.
I can also Google it myself right now after I stop talking, but
okay, awesome.
Go ahead
Thank
and
you.
ask your other question.
And then my second question is, I'm interested in looking at the institutions that you guys partner with for people who are doing their practicum. And I was wondering if there is an institution that sparks our interest, if we could be connected with maybe a student who's done their practicum with them or a faculty member who's familiar with the institution.
Yes, 100%.
Okay.
That is something that we would work on after you're in the program. And you could set up a meeting with me or with the public health nutrition RISE office person who is Candace. Either one of us can help you make those introductions. And, she would be better equipped at connecting you with alumni because she has more of a database of like who partnered with what organizations. But if there's like if you already have a specific organization in mind, I can help you make that connection also.
Awesome. Thank you.
Yeah, no problem.
All right. Well, I do want to be respectful of everyone's time. I see that it's now at 10 a.m. And we have come to the end of our session. So thank you all so much for taking this time out of your day to join us and learn more about the public health nutrition concentration. We are still accessible to you as resources. If we didn't get a chance to answer your question, don't hesitate to email us at online.mph@berkeley.edu. Or as was mentioned, you can book an appointment with Stephanie, who is just super helpful. And we really want to support you and make this as transparent as possible. And thank you to Sarah for joining us and sharing more specifically about the nutrition program. Once again, thanks for joining us. Let us know if you have other questions and have a wonderful rest of your day.